All right, guys, we're going to go over this scan of the shoulder. This is the normal MRI that's in the link in the course. So starting with the shoulder here, let me try to get this centered nicely. Okay, so let's start with the bony anatomy, which I'm going to go through pretty quickly. And then everything else we'll take kind of slowly, because it can be really confusing. Coronal plane, we're starting off coronal. Bony anatomy, humerus, okay? Your clavicle is here, articulates with the acromion here. So this is your acromion articulating with the clavicle, acromion. Acromion is attached to the scapular spine, right here. Follow that around. Here's your scapular notch, okay? The superior margin of the scapula here, the lateral border of the scapula down here. Here's the glenoid, okay, glenoid here. Supraglenoid tubercle, infraglenoid tubercle here, okay? Humeral head, we want to go anterior. The first tubercle is lesser. The next, lesser tubercle, greater tubercle right there. Okay, and then there's a groove in between them, which is better seen on an axial. What else? Coracoid. So easiest way to see the coracoid, look at your glenoid and then go anterior. Here's your coracoid right here, okay? Most prominent portion anterior of your scapula. Here's your glenohumeral joint, right there. We're not quite low enough to see the deltoid tuberosity. Okay, so that's the bony anatomy that you definitely should know. Now let's start talking about some of the muscles you need to see in this plane. We'll go over everything in coronal, and then we'll go over to sagittal, oblique, and then we'll go over to axial. So glenoid labrum, not really easy to see on here. It's kind of this triangular piece right here that's coming off. You can't quite see it, and this is maybe a portion of it right here. Inferiorly, this is kind of a portion of it here. Remember, it's kind of like that halo around the fossa, the glenoid fossa. So we have the brachial plexus is right here. Interesting. And then we have the glenoid fossa, the indentation of the glenoid. Muscles. Big guy laterally, this is your deltoid muscle. Here's your deltoid. All right, and then now we need to go more anterior to find the 4 muscles that make up the rotator cuff. So the first thing you want to do, if you go all the way anterior, remember there's one muscle that makes up the rotator cuff that's anterior, and then the other 3 are posterior. So if you start anterior, pick the first anterior muscle, right, the subscapularis. Look at the coracoid. It's going to be just inferior to the coracoid process anteriorly, and it kind of has these 3 or 4 fingers that kind of come over and then insert over at the greater tubercle. I'm sorry, the lesser tubercle. Remember, the anterior muscle is the only one that attaches to the lesser, and the lesser is anterior on the humerus. So these kind of 3 or 4 finger projections are all part of the subscapularis, sub meaning below, scapula, okay, specifically the coracoid process. So there's your subscapularis right here, okay? Deltoid, trapezius, posterior. So now let's go posterior and start picking out some muscles. The first one is this big guy. That's the most superior, okay? That's your supraspinatus muscle. It's going to come around and attach posterior to the greater tubercle. Okay, and then as we continue posteriorly, we're now going to have 2 separate muscles here, the infraspinatus and then the teres minor right here. Okay, infraspinatus, teres minor. All right, so we'll go over that again. Start all the way anterior, subscapularis, below the scapula, or specifically below the coracoid, finger-like projections reaching over, attaching to the lesser tubercle. And then now travel posterior, 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 this big guy, supraspinatus on the top, and then keep traveling posterior, two separate guys, infraspinatus, teres minor. Okay, so those are your muscles in the coronal view. All right, so now let's switch over and look at all of this stuff. And let's go to axial. So axial, let's start superior. All right, here's your humerus. Here's your scapula coming in, okay? And when we look at this, we want to look at the first one you're going to see, or the view that you're going to see the easiest of the humerus is the bicipital groove right here. So there's your bicipital groove. Greater tubercle, lesser tubercle, okay? Here's your glenoid over here. We're kind of able to see the labrum, triangle, triangle here, okay? This is anterior, so now going anteriorly, following this bone, coracoid process, coracoid to glenoid, okay? And then traveling down through the shaft of the humerus. Coming up, here's your clavicle coming in from the anterior, articulating with the acromion process right here. There's your AC joint, okay? And then your scapular spine traveling back. There's your scapular spine. All right, so that's the bony anatomy. Again, your joint space, you can kind of see it here. We'll look at an arthrogram to see it even better. So there is the glenohumeral joint. Next, we'll start at the top and we'll look at the muscles. So we have at the top, the supraspinatus muscle, the most superior muscle, okay? Here's humeral head coming in. Over here is our deltoid muscle. Keep going down. Infraspinatus is down here. And then if we keep traveling down, that's going to become the teres minor. Okay? Traveling down. And then subscapularis. Okay? Deltoid. If we're inferior, this is the teres minor, infraspinatus, and then keep going up, supraspinatus. Okay, so those are the muscles in the axial view. Let's now go to the sagittal, and this is kind of the easiest, I think, to see the muscles that make up the rotator cuff. A little bit harder to make out the bony anatomy, but not too bad. So starting out, let's go all the way out and in. So out and then in, here's your humerus, okay, coming in. Up top, we have the acromion right here coming in, articulating with the clavicle. So there's acromion here, clavicle, AC joint, scapular spine, posterior, this is anterior, okay, coming back. And then now we have a different part of our humerus, okay, so we've got humeral head, now we're traveling more medial. Now we have this hook coming off, okay, there's your coracoid right here, anterior, your coracoid. And then I want you to kind of see as I go in and out, you can kind of see this like darkened kind of like a cushion. That's actually your glenoid labrum kind of haloing out around from the glenoid fossa. So indentation of your fossa and then this haloed is your labrum in there. Okay, and then the hook over to the coracoid process. Okay, and then there's your Y view. Okay, coracoid, chromion, and then down to the inferior border of the scapula. So that's bony anatomy. Now let's talk about the muscles, okay? So we start all the way out, remember, like the cap, like the shoulder pad capping the shoulder girdle. The outer portion of the shoulder is your deltoid. So here's your deltoid curtain coming in, and it's going to be on both sides for a little bit. So this is deltoid and deltoid, okay, traveling in. Okay, this is anterior, this is posterior. Okay, so for anterior, what's the only muscle that makes up the rotator cuff that's anterior? The subscapularis. Coracoid, inferior to coracoid, subscapularis. There you go. Okay, what's the most superior? Supraspinatus, right here. Okay, this guy, supraspinatus. And then over here, posterior, the other two posterior muscles, we have the infraspinatus, which is kind of two-part here. And then this guy here, your teres minor, right? And then down here, tricep. Okay, and then this is still deltoid out here. All right, so that's the kind of transaxial view of the shoulder and all the muscles and everything you should know for shoulder. Those three views: coronal, transaxial, because it's not like a true axial, and then your transsagittal or oblique sagittal. Okay, so that's shoulder. I'll do the wrist in a separate lecture.